Hello, everyone. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. Welcome to another Facebook, TikTok, YouTube, and Instagram Live. I review a lot of records, and it basically uh, hurts me to say that there are patients who've already gone through the explant and now they're not getting better, they're not improving, their symptoms continue to linger on, and now they need to come back for what is a residual capsulectomy because they didn't do the surgery right initially. We know this from the many patients who have had an explant done where their surgeon did not remove the whole capsule, did not believe in breast implant illness, and the patient had capsules left behind, inflamed tissue left behind, spilled silicone left behind, that ruptured silicone left behind, the inflamed tissue left behind, and now the patients continue to have the many signs symptoms suggestive of what is breast implant illness, and they know better themselves that they have that burden left behind because they're still relatively young or old and they have the many symptoms of what is suggestive of what is breast implant illness. So another classic example is I just reviewed the records on a patient and she had her explant done in the remote past almost 3 years ago, and I got her operative record that I reviewed just today, and as you will see, her surgeon did not make the effort to removing the capsule, and one of the ways to tell that is by the timing of the surgery. So as you will see, if you go in and no HIPAA violation here, I'm just looking at the date of the surgery, 9/1/22, anesthesia start time 8:07, and it says over here the operation start is 8:24, operation end is 9 o'clock. So as you will see, 36 minutes to doing the explant. Clearly, as you can see, that the capsule was not removed. That is true. The augmentation process in itself takes 15 minutes, depending on the surgeon's speed and skill. Under 45 minutes, under 1 hour, this is how long an augmentation process takes. Very fast, quick, especially if it's a replacement. Now, explant surgery, on the other hand, is a very involved surgery. It's a very thoughtful surgery. The surgeon has to be mentally, physically prepared for the surgery. And this is where a lot of thought process goes into if the implant's ruptured, if there's fluid around, the workup needs to be done. It's not another speed surgery. This is more about precision, about the sophistication of doing the surgery in a manner where it's not about speed, it's more about skill. And so what I did was I essentially prepared on this board so you can see, and Mara, if you can check if this is going to all show up nicely. Yep, okay. So checklist to ensure proper explant. Number one, the length of the surgery should be approximately 4 hours. So in my practice, I take plus minus 4 hours to doing the surgery. There are times where I've gone in and just the explant alone, it took almost 6 hours. And there are times I've gone in where, one of the NBA players' wife, I was able to do hers in approximately an hour and a half. And it was done, documented, it's on YouTube. And this is where the implant was above the muscle. It was calcified and it was a very small implant. And certainly it is very doable in that situation because of the way her implants literally were, quote, popping out themselves. So on average, 4 hours. Now I see a lot of surgeons, the patients tell me that their friend got a surgery done by a surgeon who did fat grafting, a supposed lift, and an explant in 2.5 hours. So this is a big red flag in my practice, in my analysis, in my evaluation, as I talk to these patients who are complaining of the many hurt of what is breast implant illness symptoms, as if they still have their implants. The length of the incision, so the diameter of the implant essentially dictates the length of the incision. So another patient came to me that she had an en bloc done through the nipple areola complex, impossible. Another patient that had an implant removed from like a 2-3 centimeter small incision, impossible. One has to be able to visualize, clearly see the entire length and spread of the implant on the rib. If you place an implant on a table, you will see, and especially when you press it against with the muscle, so it spreads out even more. And the implants initially, when they were placed, they are much further up. They only gravitate, fall down and they bottom out. And as you will see, this capsule spread is not only where the implant is, but usually all the way up to the clavicle. So the length of the incision is key to do a dissection that's completely safe, complete, and less bloody and involved because of the medial spread, the way the capsule spreads to the midline of the chest towards the lateral side and upper 2 finger breadths below the clavicle. So that length of the incision is very important. That helps me, it basically gives the confidence that the capsule was removed or not. The pathology, the document size of the capsule. So anytime the capsule is sent to pathology, they document and measure the size of the capsule. So in one patient's case where she had a supposed end block, the implant was 500 cc's, and her pathology capsule specimen was 3 by 4 centimeters, and I know clearly the capsule is a lot bigger, 3 times as much. So her capsulectomy was not done completely. So this is to, and you must send this off to pathology to rule out cancer and to rule out malignancy, the CD30 analysis. Number 4, the implants must be returned to the patient, especially in sealing implants. These implants are ruptured and then pulled out. This is not the right technique at all because this is not how explant surgery is done. In my practice, I remove the entire capsular tissue and implant as en bloc or 100% total capsulectomy. And you want to return the implants to the patient so they have mental psychological closure that the implants were removed and they match the card, they match that they were symmetric, and that basically have confirmation the implants were not damaged by the surgeon upon removal. Number 5, which I say is critical, and that's why the green asterisk, high definition videos, pictures of not only the chest wall, very, very important. If you have visualization of the chest wall showing complete removal of that capsule, what could be better proof than that? And also cutting open of the capsules on the table such that the implant and capsules, the capsules are cut open and the implants are now basically shown that the entire capsular tissue was removed. I see so many videos, pictures that the patients have shown me where the patient's initials, date of the surgery is not done. How do you know that's the patient's? The surgeon could have made an error in giving that video back. Some surgeons say they do not document or record. No, this is extremely important. If you take your gallbladder out, who cares? You do not want to see a picture of your gallbladder, but in this case, you want to see the high definition pictures and videos of the chest wall. This is the ultimate proof that the capsule was removed, and the surgeon should be happy and willing to show this, and you must require your surgeon to give you the videos and pictures. So in my practice, I show the high definition pictures and videos of the chest wall showing complete removal of the capsule and implant. And number 2, the cutting open of the implant and capsule on the table so that the patient has no doubt that the entirety of the surgery was done in the manner described. And the other one, number 6, the Facebook, Instagram, web page, social media check and balance by the patients and system. Every surgeon who is doing explants must have a Facebook page or YouTube, TikTok, Instagram page where he or she is very openly transparent and discussing how he's doing the surgery, why he's doing it, what is he sending off to pathology, microbiology, and that the previous patients, the patients who have had their surgery, are talking to one another, because that's the true ultimate check and balance that the surgery is done right, and there is complete faithfulness and sincerity and honesty in regards to how the surgery is done. Some of the surgeons show just the nice, good, simple, easy cases where the implant was above and they're showing a total complete capsulectomy. In my evaluation of these operative notes, just like this one, clearly if you put the checklist, if you put this analysis through and you process the information, one will easily reach decision and conclusion with confidence that the surgeon is doing the right surgery. Now, there are other factors that come into play, such that your surgeon is only explanting and not augmenting. That is very important. Remember, an explant surgery takes on average 4 hours. An implant augmentation takes approximately 1 hour. So the surgeon who is explanting only is doing a lot more tedious surgery, more involved surgery, more dangerous surgery, if you will. and the surgery that's extremely involved. The physical ability to do the surgery is a lot more. The neck back strain, if you will, of the surgeon is more. The financial gain by the surgeon is a whole lot less, because in the time that it takes a surgeon to doing an explant, 4 hours, another surgeon would easily have done at least 3, if not 4 surgeries. So he's basically cutting his paycheck by at least a third by explanting. And this is the ultimate professional, I don't want to use the word compromise, the right thing to do. This is ultimately that it basically authenticates the surgeon is doing it right for genuine reasons. How can you go to a surgeon who basically is augmenting and at the same time explanting, and you can see that this gets diluted, the message, the advocate nature of this surgeon gets diluted. Unfortunately, I have seen this where a patient went to another group, where within the group are 3 surgeons. One is only sold because he or she is marketed better for explant surgeon only. And this is where, when the patients ask to test to see if you're explanting only, the surgeon says yes. And unfortunately, within the group, they're doing profit sharing, so that the other patients who are asking for augmentations are referred to the other 2 surgeons in the group. So you want to be able to absolutely authenticate and certify within the group in that business as that entity that there is no one else augmenting, because of the nature of how the message is diluted, and it is not done professionally and ethically correctly. Remember, the implants cause the hurt, as we know. We know that a lot of objective evidence from the manufacturers, from the FDA, and ultimately the many patients who are hurting. This surgery is all about integrity, honesty, sincerity. The surgeon must wholeheartedly believe that the implants are causing harm, and they should actively be talking about it and basically promoting the idea that if there is badness, breast implant illness, capsular contracture, pain, among others, that the surgeon is available to do a complete thorough job, so that when we look back at it, there's complete transparency as to what the patient understands. I will go ahead and if there's any questions you may have, please continue to ask. On Monday the 11th, I'm doing a very interesting Facebook Live along with the patient and her husband, who was key and instrumental in having the diagnosis made pre-op, such that he himself went through the task and the homework as to why his wife was going through the troubles of what is breast implant illness. We'll hear from her directly. We will hear from her in regards to the benefits of the explant. We'll hear from him as to what thought processes he went through in order to conclude that her medical relief was going to come from removal of the implants in the capsule, and we'll hear directly from them. So certainly please do not miss. And if you have any questions, please write them down in the comment section, and I'll be more than happy to address. The take-home message here is this: breast implants are not benign devices. They're being sold right and left nonstop every single day, not only in the United States, but all over the world, as very safe. And once you get them, you're not going to have any problems for the rest of your life. This is certainly not true. Implants cause hurt and harm. There are implications behind getting them and not getting them. And if one has them, what they should be looking out for, so that when the problems do arise, that they get a complete and definitive relief by not only removal of the implant, but also certainly the capsule and the inflamed tissue about. And I'll end with this: it is integral, important, and absolutely, I use the word in my practice, required to remove the entire implant capsule and all of that inflamed tissue completely, sincerely, definitively. We know this, number one, from the many pathology reports. If you can give me those pathology reports. Thank you, Nora. So yeah, thank you very much. If you will look at the many pathology reports, so we have, and I'll conclude with this. Why should the capsule be removed? Number one, I should say 3 reasons. 3 reasons. Number one, you look at the capsule that is removed, that I always send to pathology, and the capsule tissue, not in all, and patients comes back as cluster of foamy macrophages, focal foreign crystalline material consistent with silicone associated giant cell reaction. This is classic example why the capsule must be removed completely. If the capsule is not removed, the silicon particles, the giant cell reaction, the non-polarizable material consistent with silica will remain behind and will continue to trigger the immune response, and the patient's not going to benefit. So that is the ultimate, the proof in the pudding. Here is the classic proof. The next proof is, if you can give me that, let me see over here. Let's say, yeah, I got it right here. If you look at the patient communication guidance for industry and Food and Drug Administration staff, document issued on September 29, 2020, and this is by the FDA, it tells you right here, and I'm going to show you the page. All right, here we go. Systemic systems. This is page 13, and they want you to initialize. So this is the surgeon talking to the patient who is interested in getting implants. I understand that some patients have received breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, rash, memory loss, and brain fog, and some patients have called breast implant illness. It is not some patients have called, we know it is breast implant illness. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with removal of their implants and surrounding scar tissue capsule. So they're telling you remove the scar tissue capsule. However, not all patients may experience improvement in their symptoms. Now, the reason behind that is, as you will see, that there is a potential that there is gel bleed occurs. I or the physician may not be able to tell the patient exam whether the implant has ruptured or is leaking silicone gel, and it tells you that basically that those patients that not improve, they have, and looking at the next page at 14, I understand silicone can migrate from an implant into nearby tissues, chest wall, lymph nodes, under the arm, organs, liver, lungs, where it may not be possible to remove. So in those patients, we remove the entire implant capsule and they're not improving because the silicone has migrated to the other areas of the body. Not in all, in small subset of patients. So that's the second proof. They're telling you remove the capsule along with the implant because that's where the relief is. And then the third and the ultimate relief is where you talk to the many patients who have gotten an explant and the capsule was left behind, and then they sought out a surgeon who does residual capsules, inflamed tissue removal, and then the patients improve remarkably. And that in itself is clinical evidence proof anecdotally. And if you talk to the many patients who have had residual capsules removed, like this patient who's coming, whose op report that I read, they continue to hurt, they continue to express the many signs and symptoms. These patients clearly and definitively state that they have improved remarkably and back to baseline once all of that capsular burden is removed along with that inflamed tissue. And these are the patient's own words, which are very powerful, and this attests to the fact that the whole capsule must be removed. Do it right, do it once, do it with someone who truly believes honestly, with integrity, who will take the time and effort and sincerity to be doing it. This is the surgery where you want to do it once, you want to do it right, you want to do it thoroughly, such that when you look back at it, and I will end with this, the capsules are sent to pathology to rule out the BIALCL. The cultures are done for aerobic, anaerobic, and fungal. Drains are not used. Clearly, I've not used drains in well over 5.5 years, even with the many ruptured cases, large implants. The implants are returned to the patient, be it the saline implants or silicone implants, or even if they're ruptured. High definition pictures and videos of the chest wall are done to show complete removal of the capsule off of the rib and cutting open of the implant capsule on the table. Number 6, the twilight deep sedation. No lift is done at the time where majority of the patients do not need the unnecessary lift. Even the 70-year-old patient would not need that lift, as shown and seen and discussed with the many patients who have come my way. No doing unnecessary surgeries. And as you will see, almost 80% of the patients do not need that unnecessary lift if the implant is reasonable size, if the initial surgeon was a good surgeon, and with the pseudo lift technique, the tissues are brought in together such that no true lift is required. And eight, last but not least, that the surgeon and is an advocate of breast implant analysis, believes in breast implant analysis, is not augmenting, is only explanting, and is very thorough and meticulous and detailed and transparent on social media, such that the entire surgery is done in the manner described, willfully, happily, with enthusiasm. I will go ahead and conclude with this. Please ask questions. Till next time, take care, and we hope to see you on the 11th of August for another Facebook Live. This is Dr. Khan, Executive Plastic Surgery.